Good afternoon. Thank you for coming and thank you for having me. I appreciate it. So today I'm going to discuss a little bit about inflammation and how we can improve or reduce inflammation overall to improve health. And I'll go in a little bit about how acupuncture addresses that, as well as using some herbal supplements and other types of approaches to health. So first of all, what is inflammation? Well, inflammation is the body's normal physiologic attempt to defend against foreign invasions and repair it from injury. And this can result from many different ways. Injury can result from things like trauma, infections, toxins, or what we call SAD, which is a standard American diet, which we did not have today. So that was a nice, well-rounded meal. So chronic inflammation, which is what we don't want, is when injury occurs, it's ongoing, and its predisposed immune system fails at counterregulation. So in other words, the immune system kind of kicks on and it never shuts off. And so most chronic diseases have been linked to excessive or persistent inflammation. So when we have chronic inflammation, we get all these diseases that we do not want to get. And so what can we do to reduce that inflammation, be proactive, be preventative to keep these things from happening? And we'll kind of go over a lot of those things and the best approaches to keep that from happening. So as you can see, here's another little longer list of chronic diseases that can occur from long-term inflammation. So it's a lot of things there that we certainly, like I said, we would like to avoid getting overall. So how do we get these things? Well, we have genetic susceptibility to certain triggers. And those triggers can be a whole range of different things, and I'll kind of go over that a little bit too. We can also get chronic inflammation from overabundance of inflammatory precursors, such as a poor diet, high in sugars or high in arachidonic acid, which is high AA. Arachidonic acid kind of perpetuates that inflammatory process. So we can also get chronic inflammation from lack of antioxidant phytochemicals, which we get from our diets or either supplementation. Trauma can also cause chronic inflammation, and that trauma can be from mechanical, chemical, thermal, or electromagnetic, which electromagnetic, it doesn't occur quite as often as the others. Cellular debris, nucleic acids, uric acid, etc., all those things, things that are actually in our body already, and there becomes this reaction in our body that sees these things as a pathogen or foreign invader, so the body starts to attack these things. And these things can, they might go outside the cell wall where they shouldn't be, and that's when the body says, hey, this shouldn't be here, so let's tag it and start creating this inflammatory process. And over time, you start to develop these signs and symptoms early on, and that could be fatigue and insomnia or just a little bit of joint pain, and then eventually that could develop into more serious conditions. Of course, pathogens, so viruses, things like that, toxins, exposure to chemicals in our environment, and heavy metals. And then, of course, free radicals, which is basically all the things that starts to destroy our cells that we don't want. And that's why we take basically antioxidants. So here's some more causes of inflammation. Omega-3 intake, lack of sleep, lack of exercise, poor recovery, or in other words, so if you have athletes that train all the time, they run marathon after marathon after marathon, that can also perpetuate more chronic inflammation. So, everything in balance, too much of anything isn't necessarily a good thing. So, chronic stress, lack of downtime, lack of time outside, and then, of course, now we're seeing with evidence-based medicine, so poor gut health overall, which can affect us in a whole myriad of different problems. So here's just your general inflammatory response for all the science nerds out there. But I find it very interesting. So kind of gives you a better idea of what's going on internally and how we address things. Here's a couple of other things, like the way of inflammation affects the body, kind of with each organ system. You have, the kidneys, inflammatory cytokines can restrict blood flow to the kidneys, and you can get complications like edema, hypertension, nephritis, kidney failure, things like that. So as you can see, there's a lot of things that can occur through having too much inflammation in the body overall. So when we are in a perpetual inflammatory state, we produce these things called inflammatory cytokines. And even though they're good in a short term, long term they cause a lot of damage to our body. And they can even initially cause things like lack of energy, difficulty concentrating, sleepiness, and loss of appetite, which is kind of very obscure problems. And if you typically go to your physician, they don't know how to treat that because they could run blood work and see that everything might look fine on the blood work at this point in time. Although they could check a couple things like your CRP, which is your C-reactive protein, and your SED rate, which are both inflammatory markers. And those might be a little elevated. So, being preventative and trying to get this down could prevent having, more serious illnesses later on. And then now what we're seeing is there is certainly a connection between depression and some inflammation. And there's a couple of studies that recognize that is a real problem that we're seeing these days. And then there's the stress factor. So stress can cause a lot of inflammation in our bodies. Basically, this is how in a situation, let's say you get in a car wreck, these are the types of things that you would experience in that situation, which is fine. That's what's supposed to happen, the flight or fight response. So all these things, muscles tense, skin reactions, the spleen reacts, the liver reacts, all these things. But over time, if this is long term, this is not a good thing. We end up with chronic muscle problems or panic attacks, things like that. So there's a lot of things that, and blood sugar, we could end up with being pre-diabetic based on being overly stressed because our cells start to become insulin resistant over time based on the stress reaction we have. So this is just kind of another diagram of stress overall and how it affects us in adverse ways. All the glands that are involved. And as you can see here on the bottom left, there's continued stress. The body attempts to adapt. It releases cortisol, which is a stress hormone. And it downregulates the immune system, makes us susceptible to infections, things like that. And then we can get all these other, on the right-hand side, these symptoms that start to occur. And nowadays you start to hear a lot more about adrenal fatigue and things like that. But there are levels of that. Adrenal fatigue, if you actually had adrenal fatigue, you would be in the hospital because it's fairly severe, and the only way to address that is through rest and some medications. So we don't want to get to that point either. So how do we stop it? So inflammation can be dampened by avoiding triggers and modulating inflammatory mediators with things like lifestyle changes, diet, supplements, and sometimes, if it's severe enough, medication. So ways we can address these or ways that I address things in my practice is through acupuncture, nutrition, botanicals, vitamin and minerals, and sometimes work in conjunction with physicians to add in pharmaceuticals. And I find that if it's severe enough, a combination of all of those work best. And once again, going back to the idea that everything in balance and not too much of one thing or the other. Too many medications can cause a problem. Although they are necessary at times. So going into a little bit about acupuncture. So acupuncture, also known as dry needling, neuromuscular acupuncture, and trigger point therapy, they're all pretty much ways of treating different patients, and there are a lot of different styles of acupuncture, but those are different names, and most of these are more kind of westernized terms for acupuncture. So acupuncture is sterile surgical steel. It's used once. Then after we use it, we put it in a biohazard container. We don't put it in a tray and put your name on it and use it later on. Basically, that is not the actual size of the needle. So you they're very small. I've got a couple needles, and actually, you really can't even. Wish I had like a little camera up here to show you, but they're very, very, very tiny, and they're in a tube, so it's not the size of the tube. It's actually that right there. So most people think that they're going to come in and get, almost like you're getting a blood draw or something like that, and it's nothing like that at all. So each point, acupuncture point, has an action and indication, meaning that each point does something specific, whether that's constipation, diarrhea, immune response, fatigue, hot flashes, night sweats, these types of things, from a Western point of view. And then, of course, there's the Eastern idea of how acupuncture works, which is about 3,000 years old. Those terms, in my opinion, are a little outdated. So telling someone that you're moving chi doesn't always sounds a little weird to some people. But that's the terminology they used 3,000 years ago. They didn't have blood work. They didn't have, they didn't really understand the full aspect of blood and what was going on. So that's how they described it. So at the acupuncture points, we see a lower electrical resistance, meaning that the body is more open to receiving that stimulation. So we're not putting the acupuncture needle in the nerve, but it's an area that's surrounded by a dense group of nerves. They're dense in sensory receptors and, of course, trigger and motor points. So trigger points and motor points are essentially, it's where the nerve ending attaches to the muscle, and when you hit that point, it releases the muscle. So you actually get a little contraction. And it's great for releasing scar tissue and things of that nature. So more musculoskeletal problems. And then there's also junctions for bilateral superficial nerves at those acupuncture points as well. And there's a lot of research being done, and there's a couple of cited researches that are show kind of what's going on here. So this is just a picture of the acupuncture points. There are actually more than that on the body. So I think that the normal, if you look in textbooks, it's about 300 and some odd points, but I'd say it's closer to 1,000, depending on what system you look at. Excuse me. And you get different people through research to figure out that, this point does this and this point does that, which you don't see on this model here. This is just your traditional model for acupuncture. So once again, here's some points. There's a alphanumeric way that they label each acupuncture point, and there's, of course, actually the Chinese name along with that. And then this is kind of the meridian system where they run. So typically what's interesting is sometimes when you treat somebody, you put a needle in a point and they say, I felt that down in my leg, or I felt that run down my leg, even though you're treating, let's say, their neck, and it follows that complete pathway of the meridian system. We don't know how they came up with this, and that's the one thing that we're trying to kind of figure out. But we do know that it works, and research shows that it does work. So these are all things that acupuncture treats. And if you kind of take this list and go back to a list of a lot of the chronic diseases that we talk about, acupuncture is great for treating a lot of the symptoms that are associated with those chronic diseases. So, a lot of these are itises, your arthritis, your sciatica, your back pain, abdominal pain, constipation, diarrhea, irritable bowel disease, and most of these are inflammatory in nature. So that's why acupuncture is a good method for treating inflammation overall. Now, it won't fix it completely, but it does help address it, and it does help the body to regulate things a little bit better. So maybe that long-term chronic response of inflammation starts to settle down. The other thing is acupuncture is great for treating the side effects of chemotherapy, radiation, and for surgery. So if scar tissue develops over time after surgery, which we see a lot of, and that could be a couple years after surgery, and that could be weeks after surgery. So nausea, vomiting, constipation, diarrhea, neuropathy, night sweats, fatigue, and a host of things that just makes the patient a little more comfortable during treatments. So how does it work? Well, it works through the limbic system, and I'll go into more detail about that. It works with the somatosensory cortex of the brain. Also, the needle insertion is a form of microtrauma, so it actually kind of initially creates an inflammatory response locally, which is a good thing, and then that settles down over time, but increases blood flow to the area. So if there is injury, you're basically directing blood flow and the immune response right to that area specifically. It works with our neurotransmitters, our immune system, reduces stress hormones, and it stimulates our pain receptors. And that's more of the what we found through all the research that's being done. Of course, the original Eastern therapies are blocked chi and meridians cause illness, organ system imbalances, and emotional stress causes illnesses, which 3,000 years ago they figured out that was certainly a problem. And we're just kind of recognizing that today. So the limbic system, it's basically part of the brain, centrally located, part of the amygdala and the hippocampus and a few other parts of the brain, but that's where the acupuncture stimulates the central nervous system. And what the limbic system does, and this kind of shows when they did a functional MRI with patients that were being treated with acupuncture, you can see areas of the brain that light up. And these are different types of acupuncture points. One in particular, stomach 36, they show that it does increase our immune system, T cells, things of that nature that help us fight off disease, infections, and things of that nature. I have a lot of patients that come in, they may get sick 15 times a year, and we treat them on a regular basis, semi-regular basis, and they may get sick once a year. So it really does help stimulate the immune system. So what does the limbic system do? Well, it does a lot of things. It helps with our hunger and thirst, response to pain, levels of pleasure, sexual satisfaction, anger, aggressive behavior, and blood pressure, breathing, lots of other things that basically all of our homeostatic processes that we typically don't think about that just occur. So it almost kind of regulates those things, balances out if they're out of whack. That's why you're able to take acupuncture. If someone comes in with a myriad of symptoms, you're able to treat all those things at once because you are targeting this area of the brain specifically. Even addresses blood pressure, digestive issues, breathing, and heart rate, and things like that. Growth and metabolism. The hunger thing, I think a lot of people ask me about weight loss. More than anything, it doesn't stimulate metabolism so much as it reduces that hunger response or cravings. So sugar cravings, people have sugar addictions, things like that. So all the neurotransmitters, these are all the neurotransmitters that it affects, which is a lot. So serotonin, dopamine, all the feel-good neurotransmitters that a lot of the antidepressants that we're prescribed these days addresses as well. And of course GABA, which is a relaxation, it's a neurotransmitter that deals with our relaxation state of our nervous system. So you get that relaxation response with treatment either way. So people are like, oh, well, are you treating me for stress? And all the points treat you for stress basically, or anything. And I have a lot of people that they don't have any real issues, although they might be a financial advisor. They come in just to be treated for stress once a week, and that's, and you give them lifestyle changes and you make those recommendations, and they're like, well, I'm not changing that. I'm just going to come see you and take my nap and I'll go back to work. So, most people fall asleep on the table. It's a very relaxing experience, which is kind of hard to believe when you put needles in someone that occurs, but it is. It's very relaxing. So, and also addresses our immunity as well. So all these things are T1, T2, T3, things that fight cancer, bacteria, viruses. For stress hormones, cortisol, which cortisol has a lot to do with our reaction to stressful environments. It also increases our blood pressure. It does a lot of things. So as you can see, there's a whole list of things that it treats. So this was a study that was done on with pain overall. They took a rabbit and they did acupuncture on that rabbit, and the rabbit was sitting on a heated plate, and they would turn up the heat a little bit, and the rabbit would get a little bit of a response, start to move its feet, and that's why they knew that the rabbit was feeling the heat. Well, after they gave acupuncture to that rabbit, they took some cerebrospinal fluid, took it out of that rabbit, and injected it into another rabbit. And they found that both rabbits had the same response to pain after the acupuncture. So it certainly is doing something to us internally in terms of our response to pain. The second rabbit, who never had acupuncture, had the same response that the rabbit that had acupuncture did, which was less pain overall. So, nutrition and diet. This is a very important part of reducing inflammation in our body as well, besides just the acupuncture aspect. And this is another part of what I do in my practice and how I treat patients, is going over diet, nutrition, and kind of tweaking things a little bit that might need to be addressed. So things like antioxidants, phytonutrients, those can make a big difference in reducing inflammation overall. Eliminate bad oils, things like that, trans fatty acids, alcohol, simple sugars, refined carbohydrates, which can all perpetuate more inflammation in the body overall. Processed foods that contain chemicals that we can react to can be a big problem, even though things nowadays are packaged as healthy. They may look healthy, but it's just a nice package that's got some trees on it and some other things that look nice. Or a lady that looks like she bakes it in her kitchen every day. So there's, we really have to read labels and look and see what we're eating, what we're putting in our bodies. Low glycemic in certain cases, if we are, if that A1C, which is, our blood sugar levels, things like that, if that's getting a little bit high, we can, reduce our intake of sugars, and that can be carbohydrates or, all the sweets and things like that as well. And usually the approach that I take is every diet for each individual is a little bit different. What works for one person doesn't always work for another person, and it depends on the goal of the patient, what they want to get out of the situation, what's going on with them, if they're having any sort of problems, whether it's digestive issues, whether it's joint pain. So that's kind of the approach that we take. It's not a blanketed, hey, you need to do all these things. This is kind of a basis that we'd like to follow, but for the most part, we tweak it for the individual, what might be going on with the individual. This is kind of a list of some anti-inflammatory foods. Some of them are more herbs than they are actually foods, but there's a lot of certainly wonderful foods that have anti-inflammatory effects in our body, which is important. It's almost like you're getting a dose of an anti-inflammatory overall. So that's why it's important to kind of contribute to follow something along these lines to reduce inflammation overall. So in terms of botanicals that might reduce inflammation, here's a quick list of a few botanicals I use in my practice, but not all of them. All right, thank you. Another supplement that I use a lot is quercetin. It's found in tea, onions, berries, apple skins, broccoli, cruciferous vegetables. It has anti-cancer properties and blocks a lot of those anti-inflammatories. There have been some studies that shows that it works well to bind to estrogen-positive cancers. It's been shown to work quite as well as tamoxifen, which has a lot of kind of side effects that are very uncomfortable for patients. And this is kind of where you find high doses of quercetin, or you can supplement with quercetin too, which is around people that have seasonal allergies, things like that. We I'll prescribe them during those times, and it'll help with reduce those attacks from seasonal allergies. Ashwaganda, which technically is not a anti-inflammatory, although it addresses cortisol levels, which can perpetuate that inflammatory response. So it does a lot of other things too. It actually is good for also good for chemotherapy-induced leukopenia. So people that have low white blood cell counts. Turmeric, which we hear a lot about these days, which is basically a herb that does it all. A lot of people are taking it these days, and there's certainly nothing wrong with that. It does a lot of things. The downregulation of NF-kappa beta, that NF-kappa beta is basically what all these Humira and biologics that you hear about on TV, it blocks that. So it does the same thing that Humira, not to the extent that Humira does, but without the issue of developing other infections and things like that, because
Is it a different dosage? I mean, all of us know we can order this stuff online or go to a health store, but is the dosage determined based on each individual, or is it pretty much standard?
there's a maintenance dose and there's a therapeutic dose. And people that are let's say if you're, well, I eat turmeric, I incorporate it in my food, well, you have to do about 10 grams a day. That's a lot of turmeric, you know, and that sometimes may not taste that good overall.
So what would it be different? Can we look this stuff up for us for a standard? Or?
You can, and I base it on the individual and what's going on, because each of these anti-inflammatories, they do kind of a little bit different thing for the individual. So based on what somebody's coming in for, we will utilize, maybe it's turmeric, maybe it's boswellia, or just frankincense, maybe it's a few other different types of herbs. So it just depends on what we're treating. There is a kind of a standard therapeutic dose, which is about, where is that? I thought it was up here. It's going to be anywhere between, you know, you can do 2,000 to up to 4,000, 5,000 milligrams a day, which is a lot. But now that's... No, not by any means. These are just no. These are, and I want people to understand that you should consult somebody who really knows what they're doing and has some sort of educational background in this, and not just, you know, someone who, a friend or someone who may be trained in another, you know, oh, I did some seminars or whatever, and I know about this, that, or the other. So someone who's licensed, who really understands what they're treating, why they're doing the dosage that they are, because it is important in treating these things. Because some people come in with very serious diseases, and you know, I think it's best to consult somebody as opposed to just trying to do it on your own. Because a lot of times people do that and they do not get the results that they would like to see. So I know we're kind of running short on time here a little bit. So turmeric, there you've got 750 to 1,500 milligrams a day. That's just kind of more of a maintenance dose more than anything. But so it's good for things like RA, irritable bowel disease, lupus, osteoarthritis. Once again, the way I'm kind of explaining these things, that's more of a Western idea of how you would treat things. Hey, I've got this, you take this herb for this. And that's not looking at it from a holistic point of view of really what's going on with the whole body system. And that's what's important overall, is to look at the whole system and not just treat it for each specific symptom or disease name. Ginger, which is similar to turmeric, does a lot of the same things. NF-kappa beta inhibition, and it's once again, it's not tolerated as well as the turmeric because it can kind of be harsh on the stomach, although it is used for nausea, things like that. So a lower dose is usually is tolerable for most people. Frankincense, boswellia is also another good anti-inflammatory. Same thing, they all kind of do a lot of the same things in terms of the areas they hit to block that inflammatory process. And same thing like asthma, osteoarthritis, IBD, and rheumatoid arthritis. And the doses for that is about 300 to 400 milligrams 3 times a day. So no, I don't ever, if someone comes in with all these, inflammatory problems, I don't put them on all these herbs. The approach I take is less is more. So we might start with a few things, make sure we're getting the response that we want, making sure that it's working, and not just having somebody walk out with a handful of herbs and not really knowing why they're taking it or which one is actually helping. Because it gets expensive, and I like to keep costs down for my patients. Probiotics, as I mentioned earlier, we're seeing a lot of research on gut response to the inflammation and immunity. And if the balance of bacteria in the intestines is not where it should be, which is called SIBO, small intestine bacterial overgrowth, we need to supplement with that in certain cases of people with digestive issues. So, and each bacteria does a specific job overall. And depending on, once again, what the individual has, you would prescribe different probiotics for different patients. So there's not one specific, brand or one specific. It's all about the strains of bacteria that's in the probiotics. And that's the most important thing. So as you can see here, it's kind of a different species of bacteria and what they do. And then kind of what probiotics can do for different types of disorders, allergies, IBD, things like that. Essential fatty acids, an important part of reducing inflammation too. Now as far as essential fatty acids go, that is something I think most people should incorporate if they're not eating enough fish throughout the week. So in terms of recommendations for supplements, this is something I would say, well, it's probably good that, everyone take a little bit of fish oil. So different sources of it, evening primrose, borage oil, blackcurrant, and there's different combinations. So going back a slide, you want your ratio to be, EPA, DHA, 3 to 6 grams per day, but that ratio should be about 1.5 to 1 for those. So when you're looking at certain things, but once again, I would really consult somebody who has an idea of what's the appropriate dosage for the individual. Because you can take a high dosage of fish oils for some time, 3,000 to 5,000 milligrams a day, which is a lot, but that's going to get the inflammation down faster as opposed to something like a maintenance dose that may keep, your heart health a little bit better overall. So vitamin A is another good, basically vitamin to help reduce inflammation in conjunction with vitamin D as well. So all these things can be helpful. And usually, when people come in to see me, we do a very detailed health intake. We look at every organ system of the body, what might be going on, to get a clues into what's happening in the body, and not just saying, well, I have, IBD. Well, here, take this herb. Well, there's probably something else going on that we need to address. Yes, we need to address the irritable bowel, but there's some other things, whether it's joint pain, whether it's, and all give a little clue into the bigger picture of what really is going on. So that's kind of the whole point of treating things holistically and not just treating things based on a symptom.
Could you go back to the slide that had all the foods on it?
Mm-hmm.
Those of us sitting in the back couldn't quite see all of those.
If you